Hey. So first of all, thank you. So yes, we do. So I have a lot of out of town patients. I might estimate that probably maybe about 40% of patients come from out of town. Um, and as far as our protocol, so this is how it works. It depends on how far you're coming. So I'm in Nashville, Tennessee. I have a lot of patients who come from Memphis. And so those patients, I always think if you're 3 hours or less in terms of the driving distance from Nashville, then I usually have you in town for about 2 to 3 nights. And that's really regardless of what surgery you have. My thought is this: if you need to get back for whatever reason in that time frame, you can. It's not the easiest. It's still a 3 hour drive, but you can, right? Anything beyond that, generally I have you stay in town for a full week, and that's for the majority of surgeries I do. If it's like a breast augmentation and that's all we're doing, and you live 6 hours away, I might be okay with you leaving a little sooner than that. But that's answering the question in terms of how long do you stay. Now let's back up in terms of preparation for surgery. So typically what happens is a couple weeks before surgery, one of my nurses in the clinic actually will call you, and that's called a phone call preoperative appointment. And what that means is basically, and this is provided after you schedule surgery, etc. And then of course, let me back up a little bit further. My consults are virtual. I do a lot of virtual consults, virtual post-ops in general in terms of the process. So, but 2 weeks before surgery, you have a phone call with one of my nurses. She'll go over everything with you. But also what we do is we also call your prescriptions in where you are. So let's say you live in Michigan. We'll call your prescriptions in Michigan so you can pick them up before you come, and that way you have it all set for you. And we'll also send you all your instructions and things so that you can have something you can look at and review, so that it's not all bombarded to you the day before surgery. Now, the day before surgery, you'll come in for an in-person pre-op, which basically means you'll come in, we'll go through everything with you, we'll take photos, we have a bag. It's a really nice bag that we give you, but it also has supplies in it that you'll need as well. And that's kind of your in-person pre-op appointment. We also meet in person, so I'm never going to operate on somebody that I don't meet in person. Like, that is really important to me, to meet you in person, like to see your eyes, see your intonations, and just kind of, go through everything with you. Of course, on your virtual consult, it's with me as well. Now, you have surgery. Typically, people will be in recovery for an hour, 2 hours, depending on how you do. The day after surgery, every single patient is going to have a next day visit at their home with Lisa. She's a provider who works only with our practice on Aesthetics, and she sees patients after surgery at either their Airbnbs, at their hotels, at their homes with people in town, and she'll see patients, change dressings, go over everything with their person helping them as well. She also does overnight stays, so she'll actually stay with patients, in their hotels or Airbnbs overnight, check vitals, do their dressing changes, and just really help their family get a head start, honestly, in terms of everything. Now, going back to this, let's say you want to come in and you don't have anyone to help you. I would say we've probably had half a dozen patients do that who've come in, and some big surgeries, and they really want the surgery, but they don't have people to come and help them, right? That's a big commitment to ask someone if you don't have that, in your life, for example. So in those situations, we have different things we can set up. We just need to know way ahead of time. But I have Lisa who does those stays. Ty is also a nurse who also does the stays as well. So we've had patients set up where we can pick them up, bring them to their hotel or Airbnb. One of the providers will stay with them. Then another provider will switch off, stay with them in the first 3 days or so, first 2 to 3 days, until they can be semi-independent. And then we'll have somebody checking in on you. So again, there's different ways you can kind of set it up if we know in town. Now let's talk about what happens after surgery. This is not a place where you're going to come and you're never going to see us again, even though you're out of town. So how it's going to work is that you always will have a contact to reach out if you have questions. Once you leave town, I do virtual follow-ups. I do virtual post-ops. Usually at week 1 is going to be your in-person for the most part, because most people, are going to come a little further and have to stay a full week. And then you have another visit at 3 weeks, 8 weeks, 6 months, 1 year, then yearly. And so those visits, many of those visits are virtual. I do like my patients to come back at some point between 4 to 6 months in person, so I could just see them in person. Now, some people don't make it, and I prefer to see you in person, but in general, I like to see you at some point between 4 to 6 months. And some people, just can't make that. So occasionally I have people who just don't come back until they're 1 year, or things like that. But I always like to see people back. We always keep tabs on you. We always check on you. You always have a resource to check in with us as well. So it's not like you have surgery, you leave, and you don't exist anymore. Once you're here, you're always family, no matter where you are. Okay, I hope that helps.